Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
All right.
Hi there.
Hello.
So I have a few quick questions. Most are for Dr. Herkel, and then I have one extra one. The first one is, are there any benefits to juicing?
So in general, yes. Juicing is, I think, a good way of getting a high dose of nutrients-dense foods in a kind of a quick, short way. It's absolutely, I think, very helpful to augment your diet. Now, I think where you might get into some trouble is that sometimes people look at juicing and they look things up online and then they're going to go on these juice fasts and juice cleanses. And that is, I think, while maybe short-term beneficial, I think the long-term it could be detrimental because we still need to fuel our bodies with the right amount of good fats and proteins, especially when it comes for brain function. Many times, things like a juice cleanse or a juice fast will stress your body's adrenal systems and also your blood sugar management systems, especially if the autonomic nervous system and the HPA axis are not optimally functioning. So I think this is one big downside of going on something like a juice cleanse or fast. But I think in general, to augment your diet, maybe along with something like breakfast or along with something like lunch, you can have a fresh pressed vegetable juice. I think that's excellent. There's a lot of beneficial effects on blood flow and antioxidant status. But I'd be more cautious about going on something more hardcore and limiting where you're just doing juices as part of a cleanse.
Okay, thank you. Yeah, I wasn't sure if it's good to do at the same time, like it's better to do at the same time as eating, or not. But I was thinking that it might help with, I guess, getting the blood flow. Yeah, because I have some problem with exercise. As soon as I start to exercise, it really kind of messes me up. But yeah, I'm trying to do that slowly. But yeah, thank you so much. The next one is, this might be silly, but is there a reason that you use almond butter instead of peanut butter in a lot of your talks and recipes?
Oh, it's not a silly question at all. It's a great question.
Okay.
So fundamentally, we're trying to avoid fats and foods that are more pro-inflammatory in nature. So peanut oil, which is found in peanuts and peanut butter, is more inflammatory due to its high level of omega-6s, especially things like arachidonic acid. That is going to be more pro-inflammatory, where something like almonds have a little bit more beneficial good fats in them. Secondly, peanuts are a common food sensitivity. Now, almonds can also be a common food sensitivity, as I'm finding out by running more food sensitivity IgG tests on patients where peanuts and almonds are tested, and they both kind of are equal in terms of how often they come back. And I also think I'll just say that a lot of times, because of the substitutions that are being made by quote unquote healthier type of diets where they're substituting peanuts for almonds, almonds is becoming more of a refined processed food because it's being used, for example, I just saw almond crackers, so like almond flour crackers that are gluten-free, but that is made out of almonds, and now it's being found in a lot of more foods. And in general, nuts are more immunogenic and allergy causing than any other types of foods. You can just look at any sort of pediatric kids allergist and they'll tell you that it's mainly nuts that is the problem. And so just as that type of protein is a little bit more allergenic for a lot of people. So I think that's why we make that recommendation. But in general, if you tolerate peanuts okay, then I think peanuts and almonds, you can substitute them or use a little bit of peanut butter. It's not our hill to kind of make our last stand on when it comes to the diet.
Thank you so much.
Yeah, maybe in moderation, right? Kind of switching them both if they're okay with you.
I love peanut butter. Okay. And then black cumin seed oil. My friend mentioned that, and I was just wondering, is there anything like dose that you would recommend, or?
Yeah, so we don't recommend doses in the program because that's very specific and that's prescriptive, and we don't want to do that. But I think that you can easily search an evidence-based dose online on a platform like examine.com, for example, where they look at a lot of these different natural health products and then summarize the evidence. And there is evidence on black cumin seed extract, the type of oil in it, that you extract from this type of seed has anti-inflammatory properties, and so it's not in replacement of something like omega-3s. I think omega-3s have a very unique therapeutic profile. I think this is in complement to that, and you do have to take quite a bit of it. So check out the dosage of that. And last thing I'll leave off is that there's really no evidence that I've seen for black cumin seed oil in post-concussion or even acute concussion recovery. So there's a lot better evidence on 2 grams of DHA, which is an omega-3 component, than any other type of oil.
Okay, perfect. Thank you so much.
You're welcome.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.